All right, I'm going to get right to it. I probably have 2.5 minutes now. Okay. To each his own, one man's meat is another man's poison. This is what Americans believe. This is what we've always thought. So how have we been steered from our tradition of self-reliance and individualism? Well, Daniel Webster said it best. Good intentions will always be pleaded for every assumption of power. The purveyors of government intervention will always find a crisis that gives government a justification for swooping in and making some regulation, some rule that's nearly impossible to overturn. How did this happen in medicine? As Ronald Reagan said about Norman Thomas, a 6-time socialist presidential candidate, one of the traditional methods for imposing statism on a people has been by way of medicine. Germany's Chancellor Otto von Bismarck created the model for socialized medicine back in 1883. He did it to quiet the rising socialist movement, ironically. It was like, give them their medical care, mollify them, quiet them down. And one of the first things Lenin did when he took over was institute national health insurance. It was clear. Taking control of medical care gave control over the population. Particularly, doctors were a calculated target. They tended to be free thinkers, and they had to be reined in. In the United States, the federal government jumped into the healthcare in 1798 with the Marine Hospital Service. It should have stopped there. Sadly, it didn't. Our workers had sickness funds where everybody pooled in part of their pay to help pay for the workers and their widows, children. They were perfectly happy with it. Even when states tried to impose compulsory health insurance, they rejected it. They liked their funds. But there was a crisis. The Depression of the 1890s, and that helped people decide maybe the government should come in with some social welfare programs. But nothing was done quite yet. Industry and work accidents started compulsory workers' comp insurance. So people started getting used to the idea of the government stepping in. But progressive presidents tried and failed to have national health insurance. But we needed a crisis. And here came the 1930s Great Depression. That was Roosevelt's window of opportunity to rally Americans to support government intervention on a massive scale. He started 37 agencies with reams of regulations. The seminal moment in the road to socialized medicine was the passage of the Old Age, Survivors, and Disability Insurance, what we lovingly call Social Security. Can't even say it now. That was the mother of government-sponsored medicine. Little story here. Francis Perkins, the architect of Social Security, pondered now, how can we get this law and get around the Constitution? She knew there was no constitutional authority for it. So at an afternoon tea party, and this is by her own admission, a sitting Supreme Court justice casually advised her, "My dear, the taxing power is sufficient for everything you will ever want or need." Key fact, contributions to Social Security were supposed to be voluntary, but Congress knew people would rather hold on to their own money. They could pass it on to their heirs, they could do whatever they wanted with it. So Social Security was funded by mandatory payroll taxes. Roosevelt also wanted to pull in national health insurance then, but fortunately there was enough political opposition that he dropped the idea. So on August 14, 1935, the 29-page Social Security Act became law, and the role of federal government was changed forever. Immediately, there was a constitutional challenge to the payroll taxes. As predicted, the court said, the concept of general welfare is not static, but adapts itself to the crises and necessities of the time. So the crisis model was effective. World War II brought the emergency maternity and infancy care program. That paid for health care for the wives and kids of soldiers away at war. Then in 1943, we had the Wagner-Murray-Dingle Single-Payer Health Care Act. Never went anywhere. There wasn't enough of a crisis. Post-war, we got supposedly a one-grant emergency measure where the government gave hospitals money to build. Well, guess what? 6 years later, suddenly it was clinics the government gave money to. So now the government had a big role in the diagnosis and treatment of disease. In 1960, they used the old folks as the front men. We got medical assistance for the aged, for poor older folks. 1965, we had Medicare, Medicaid. Again, the old and the poor. But this was a big bait and switch. Physicians were lured into Medicare because the opening line of the law says the federal government would not interfere in the practice of medicine. Ha, 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 ha. Now, Medicare is coercively intertwined with Social Security. If you don't want the hospital insurance, you lose your past and future Social Security benefits. In 1972, the meddling began, bit by ugly bit. We had professional standards review for government high school graduate employees were second-guessing doctors. HMOs were subsidized by the government. In 1982, when the physicians sued because of the pay freeze, the court said, ha, you can just leave the program if you don't like it. But guess what? We were trapped in it by then. Medicaid added new categories of beneficiaries, long-term care, emergency treatment for illegal immigrants. 1996, big year, HIPAA. That gave the government control over our medical records. And then after creating this big monster, the government had to have recovery audit contractors to go into doctors' offices and root out fraud. Giving charity care was considered fraud. Having sliding scale payments for your patients was considered fraud. One of the more subtle tools was the introduction of the term provider into the healthcare lexicon. It made doctors fungible with everybody else, but the stake into the heart of physician autonomy was slipped into the stimulus bill in 2009. In order to get full payment from the government, you had to use electronic medical records that were directed into the very Orwellian-sounding Office of the National Coordinator for Health Information Technology. And so we go the next year when President Obama quipped, ha ha ha, the ACA, they think the ACA is a Bolshevik plot. Well, guess what? It was. The ACA mandated benefits that the government deemed essential, expanded Medicaid to put more people on the government dole. It was about control, plain and simple. It raised costs, reduced efficiency, and took away our choices. Now we have Medicare for all on the horizon. The bill gives the government a blank check to exert total control over our medical care. The abolition of private insurance says it all. You will obey. Another reason Uncle Sam cannot be the arbiter of our medical care is this insidious culture of death. And we're not talking like Stalin or Pol Pot. This, like Carl Sandburg's little cat feet, the fog, it creeps in. This is the fog of socialism. First, we had eugenics, where the government, including the Supreme Court with the great Oliver Wendell Holmes, decided it was okay to weed out the inferiors for the greater good, even with forced sterilization. And mind you, the last one, it was in 1981. We aren't talking a long time ago. And then we have reproductive health, which now includes post-birth abortions. So why not kill the old, the helpless, and the infirm? Physician-assisted suicide is becoming normalized. Hospice is the new medically necessary treatment. That just primes the pump for rationing for all. So we found that seizing on the emotions and crisis points help shift public attitudes for government worming its way into our lives. And when the government controls your medical care, it controls your life and death through treatment denials. And you just ask those people in Tuskegee syphilis program, or the people who died when the government dropped a virulent bacterium, Serratia marcescens, over 8 US cities. Ask them, is the government looking out for you? Guess what? They're not. So it's our job to tell anyone who will listen, we will not have our health dependent on the whims of these elite decision makers in the name of the benefit of the collective. Control and coercion are not compassion. And when they ask you to sign up for Medicare for all, say no. I refuse to join the herd trapped behind the electric fence. My body belongs to me, not the state. Now, Karen told me I just couldn't get up here and rant, so I'm going to tell you something you really can do. I want you to go to my organization, who pat ourselves on the back. We're the ones who helped overturn Hillary Care. We sued and won to get her secret counsel exposed. Hear, hear. We look out for you, and just go to our website, aapsonline.org. You can sign up for the emails. It's free. We can give you legislative alerts, give you sample letters. When any of these things come up, we need numbers, just like everybody said. They have numbers, we need numbers. And I hope all of you will go to the website and learn all about this stuff, try to find a cash-friendly doctor, and we can beat them. Don't you worry.